Surgery is a huge and very personal decision. Now, this week, two studies on knee surgery and shoulder surgery giving two opposing views about going under the knife. So how do you know which option is right for you? Dr. Samadi, you're chief of robotic surgery at Lenox Hill Hospital. How do you know?
Well, it's very difficult for patients to know, and that's one of the reasons why every time you decide to go for surgery, you need to look at the pros and cons, look at the risk and benefits, and if the benefit outweighs the risk, then that's a very good option. For example, for knee surgery, they were talking about the fact that, yes, patients that went for knee surgery, and we do about 1 million knee surgery in this country, they did well. But did you try non-invasive modalities, losing weight, doing exercises, eating healthy things, etc., and getting injections in your knees? So try that. When they went for that was that study. But when they went for the shoulder surgery, surgery wasn't beneficial. It was not. And holding it in sling and also like just some pain medication help them with more modality. So the answer is talk to your doctor, always get a second opinion, have a discussion. When you go to the office, look around and see what goes on, and that's how you come down to it.
Mark, what do you tell your patients? How do you determine whether or not to do it?
Well, first of all, it's a changing terrain. Now, the first study out of Denmark they did the kind of study we like. One group got the surgery, the other group didn't. Both groups got the weight loss, got the diet, got the medication, got the exercises. They found that the group that got the surgery did better, actually. And that's a pretty revolutionary idea because, as David mentioned, close to 1 million people getting these operations. Not everyone needs them, but maybe more people needed it than we thought. But, Eric, we're moving in a direction now where we have less invasive techniques. With the knee, there's a partial knee replacement you could get where only one compartment is involved. It's a less invasive surgery. You get in and out the same day, like with David's surgery, with your prostate. You can now have it robotically. You can get in and out in one day. That decreases my worries as an internist for side effects, infections, blood clots, things going wrong. The more you're in the hospital, the more involved the anesthesia, the longer you're under the knife, the more I worry. So these are things that all have to be taken into account.
What about like stents or bypasses and these type of things?
Well, that's a great point, too. Stents, if you can get away with it, is actually, I prefer it because bypass is a bigger operation. Not everyone can get that.
I think the big message is also look at the surgeon, look at what kind of volume they have. Do they have the team? Does the surgeon actually do the surgery, or he may be running multiple rooms and he's not even involved? There's a lot of questions. What are the complications?
How do you find out that information?
Look, it's the way you have to interview them. You have to ask some of their patients what kind of outcome and results you have, and the doctors and surgeons need to be honest. Not every surgeon always recommends go for surgery. There are a lot of times, and you've been involved in some of the sites that we've had, people call in and we tell them surgery is not the right thing for you. You have to be honest, and when you interview your surgeon, you get a good feel as to what's going on.
People are afraid to ask the doctors those types of questions.
I think the doctors know. You know, like I always say on the show that David's an excellent prostate surgeon. I know who the good surgeons are. Ask your doctor. Get a doctor you can trust, an internist or a primary care doctor you can trust. Hopefully has a good network. Will know who the good surgeons are.
Good suggestion.
Yep, great advice.